Hey, Dr. Mike here. So today I want to talk a little bit about a question that I get often, but usually I try to preempt it by just letting people know what to expect especially after the first week of chiropractic care. And so sometimes people will ask, why do I get sore after I'm adjusted? And the basic reason is because your body is so used to the way it is. In other words, when we assess a patient who comes in and they have an imbalance somewhere in their spine, whether it's their neck or their mid-back or their low back, most of the times the pain is the last thing to show up. So when they come in, it's because they have had a recent crisis and they want us to help them feel better. But what happens typically is as the body goes through this process of wear and tear and degeneration, the discs get thin, the bones start to wear out, they don't move well, and then the body starts to malfunction. So eventually the pain shows up, but the ligaments, tendons, and muscles that hold the spine together usually show up with some form of scar tissue. And scar tissue, if you've ever seen someone who had a scar on their face or had an injury and didn't have surgery, that scar tissue is different tissue than the tissue it replaced. In other words, it's not as pliable or as mobile. And so that scar tissue holds things in the place of imbalance, what we call subluxation in chiropractic. And when we adjust you, the body needs to rehabituate. In other words, it needs to try to get back to normal and eventually to realign itself. So initially the body doesn't like that because it likes the old way. It likes the old imbalanced way because that's what it's used to. And because it's used to that, those ligaments, tendons, and muscles and cartilage that have scar tissue, they balk and they don't really particularly like the new position. So the adjustments and the exercises are all guided towards rebalancing the spine, creating better mobility, better motion, better function. But the body isn't used to it, so it doesn't like it. It's like if you go to a gym and the first day you show up, you hit the weights hard. The next day, what's going to happen? Well, you're going to be sore because muscle metabolism creates lactic acid and there's muscle soreness. And I always tell patients, listen to your body. If your body is telling you something that feels strange, then just pay attention to it, listen. If you go to the gym and you get sore, you know the difference between a sore muscle and let's say a pinched nerve with pain traveling down your shoulder, arm into your hand. So pay attention and listen to your body. But the reason why most people are sore initially is because of the imbalance has been with you since you're a little boy or a little girl. And what happens as time progresses is the body just kind of forms that scar tissue, and that's difficult stuff for us to work with. So the adjustment and the exercise is all guided towards reestablishing perfect balance, and the more balanced and the more mobility our spine has, the better it functions. So I hope that helps. Remember, stay informed and get adjusted.